My name is Dr. Hema Kanappan. I am a pediatric consultant and my expertise is pediatric gastroenterology.
How would one improve their child's gut health?
It's a very interesting question, a question very close to heart. So a child's gut health is no different to a family's gut health. So we as adults and parents have to set a very good example and be role models. Good family meals go down to the basics because what goes in is what determines your gut health. So the basics that the children are taught in school, 5 a day, so plenty of fruits, vegetables, and they need to drink plenty of fluids, because if you are not getting the right balance of fluids and fiber, fruits and vegetables, and depending on whether you're vegetarian or non-vegetarian, the diet varies. So you have to make sure you stick to the basics, because only then, when you have a good healthy diet, your gut flora and the bacteria, that's healthy bacteria in your gut, they are actually going to keep your gut nice and healthy. On the other hand, everybody is allowed a treat, okay? So I'm not against any junk food or anything, but everything needs to come in moderation. And when we say moderation, that in itself could sometimes be in excess. So I would definitely say no to any fizzy drink. Sugar-free drinks, absolutely not, please. Healthy is water, so stick to water. If you want to, you can infuse any fruits in it rather than actually adding any artificial things. Then, of course, apart from all these, we always talk about anything that goes in and gut and things like that. But what also determines your gut health is a good exercise routine. Definitely a good sleep pattern, less screen time. So watch what you take. Definitely make sure you dedicate 60 minutes for exercise, whether you're an adult, whether you're a child. Sleep is very important. Less screen time, plenty of water. All of these is definitely going to look after your gut. The other important question that many people ask me is probiotics. So there's nothing against trying probiotics. Many people have found probiotics actually a helpful thing, and you can try probiotics, especially if you've had a course of antibiotics because you've been unwell. Definitely the gut flora would not be at its best, so take probiotics, help the gut flora get better, have a healthy gut, healthy brain, and a healthy life.
My child is a picky eater. Could this lead to digestive issues?
Picky eater, yes, very commonly found again in my clinic, something that I deal with quite frequently. If your child is a picky eater, then of course they probably are not having the wholesome food on their plate that they are meant to have. So if they are not having enough fluids, if they are not having fiber, if they are not having lentils and pulses and everything as they are meant to have, then of course you're going to have either constipation, because you're not going to lack all the important nutrients. Very commonly when I do blood tests on these children, I do find that they lack in either iron or vitamins, vitamin D, vitamin B12. Calcium is another important thing, because if you're not drinking enough milk or if you're not having yogurt, then definitely there's going to be some element of nutritional deficiencies. And the best thing that I do or I suggest is talk to a dietitian to see what is actually going in. Are they having a complete diet? Are they lacking in anything in their diet? Because there's two ways of doing this. Either you're able to improve their diet naturally, and it takes a long time. This is not going to happen overnight, and your child can improve the dietary habits and you can work with your child to get the natural supplements. Or if they have behavioral issues like autism or sensory needs, you're not going to be able to win in that zone, then we have to consider supplements. Calcium supplements, iron supplements, vitamin supplements, a wholesome multivitamin is something that I would definitely recommend. So yes, it is either improve it naturally, or if you're not going to win, then you definitely can consider a supplement that is going to look after all these deficiencies.
What are the signs that my child might need supplements above food, above nutrition?
It's one of the most commonly asked questions in my clinic. So role of supplements such as tablets or syrups apart from food. There are one group of patients who come to my clinic because their child is very lethargic and very tired, or they don't have good skin or good hair, unable to concentrate. And when we do the blood test, we find that they have some kind of deficiency. It is the most common deficiencies that I see in my clinic are iron deficiency, folate deficiency, vitamin B12 deficiency, and vitamin D deficiency, which is kind of universal, especially in the winter months. So we have two groups of parents. One group of parents who say, "Doctor, we have an extremely healthy diet, we focus on fruits and vegetables, and I don't understand why I should supplement and why they have deficiencies." Yes, all of us focus on healthy diet, but think about lots of other things that actually counteract the way we cook, the fizzy drinks that they might consume, the caffeine intake. So all of these is actually going to dampen the goodness that you get from the natural supplements, which is diet. So then when we do the blood test and we find that they're deficient, I recommend a multivitamin which children can take every day. In these blood tests, there are a small proportion of children where it's at a very low level and they might need high dose supplements alongside the daily multivitamin that you take. So, you have natural supplements, you work out your natural sources of vitamins and fiber and iron and things like that, or you have to also think about your artificial supplements. It's not going to do any harm taking a multivitamin a day, especially if you think of, let's say, iron, for example. Iron supplements, many people don't take it with vitamin C supplements, because if you take iron with vitamin C, it's going to enhance the absorption and therefore the availability to your body is going to be better. So in essence, yes, as we always say, focus on natural ways to improve your child's diet. Cut down things that are going to inhibit the goodness of these, and there's no harm taking a multivitamin every day. And if the levels are really low, your specialist will talk to you about extra supplements.